Hello and welcome back to my channel. Today, I will be diving into an important topic that revolves around the female reproductive system: vaginal sponges. But before I delve into the details of vaginal sponges, let's take a moment to understand the incredible complexity of the woman's reproductive system. In this video, I'll explore the anatomy and functions of the female reproductive system and then discuss how vaginal sponges can play a role in contraception. So, let's get started. To begin, let me talk about the female reproductive system. The female reproductive system consists of several organs that work together to facilitate the process of reproduction. These organs include the ovaries, fallopian tubes, uterus, cervix, and vagina. The ovaries, which are located on either side of the uterus, are responsible for producing and releasing eggs, or ova, as well as producing the hormones estrogen and progesterone. The fallopian tubes are thin, tube-like structures that connect the ovaries to the uterus and provide a pathway for the egg to travel towards the uterus. The uterus, often referred to as the womb, is a pear-shaped organ where a fertilized egg implants and develops into a fetus. The cervix is the lower part of the uterus that connects it to the vagina, which is a muscular canal leading to the external genitalia. Now that we have a basic understanding of the female reproductive system, let's explore how vaginal sponges relate to contraception. When it comes to contraception, there are various methods available to women, ranging from hormonal options like birth control pills to barrier methods like condoms. Vaginal sponges fall into the category of barrier methods. Vaginal sponges, if you've ever wondered what they are, how they work, and whether they're a suitable contraceptive option for you, you've come to the right place. In this video, I'll explore everything you need to know about vaginal sponges. So, let's get started. To begin, let's talk about what exactly a vaginal sponge is. A vaginal sponge, also known as a contraceptive sponge, is a small, soft device made of polyurethane foam. It is designed to be inserted deep into the vagina before sexual intercourse to provide contraceptive protection. The sponge works in two ways. First, it acts as a physical barrier that covers the cervix, preventing sperm from reaching the egg. Secondly, it contains a spermicide, usually nonoxynol 9, which immobilizes or kills sperm on contact. These dual mechanisms make the vaginal sponge an effective form of contraception. Now that we have understood how the female reproductive system functions and the purpose of vaginal sponges, let's discuss their usage, effectiveness, and other important aspects. The sponge is easy to use and can be inserted up to 24 hours before sexual activity. It must be moistened with water before insertion, as this activates the spermicide. Once the sponge is moistened, it can be folded in half and inserted deep into the vagina using clean fingers. The sponge should cover the cervix to ensure maximum effectiveness. After intercourse, it is recommended to wait at least 6 hours before removing the sponge. One of the key advantages of using a vaginal sponge is that it is convenient and non-invasive. Unlike hormonal contraceptives or intrauterine devices, IUDs, the sponge does not require a prescription or a healthcare provider's assistance. It can be purchased over the counter at most pharmacies or online. However, it's important to note that the vaginal sponge does not protect against sexually transmitted infections, STIs. If you are at risk of contracting an STI, it is recommended to use a barrier method, such as condoms, in addition to the sponge. One of the advantages 0F vaginal sponge is that it allows women to have control over their contraception without the need for a healthcare provider's involvement. It's also a hormone-free option, which can be appealing to those who prefer non-hormonal methods. However, it's important to note that the sponge may not be suitable for everyone. Some women may find it uncomfortable or have allergies to the materials used in the sponge. Additionally, its typical use failure rate is higher compared to other methods, so it's crucial to use it correctly and consistently. Now, let me address some common questions about vaginal sponges. Question 1. How effective is the vaginal sponge as a contraceptive method? Studies have shown that the vaginal sponge, when used correctly and consistently, has a typical use failure rate of around 12% and a perfect use failure rate of around 9%. This means that out of 100 women using the sponge for a year, about the 12th may become pregnant. Question 2. Are there any side effects or risks associated with using a vaginal sponge? ANS. While the vaginal sponge is generally safe to use, some women may experience side effects such as vaginal irritation or allergic reactions to the spermicide. It's important to discontinue use and consult a healthcare professional if you experience any concerning symptoms. Question 3. Can the vaginal sponge be used during menstruation? ANS. Yes, the sponge can be used during menstruation. However, it's crucial to follow the instructions provided with the specific brand of sponge you're using to ensure proper usage and effectiveness. In conclusion, the vaginal sponge is a convenient, hormone-free contraceptive option that can provide effective protection against pregnancy when used correctly and consistently. It is readily available over the counter, allowing women to take charge of their contraceptive choices. However, it's important to remember that the sponge does not protect against STIs and may not be suitable for everyone. I hope you found this video informative and helpful. If you have any further questions or would like to share your experiences with the vaginal sponge, please leave a comment below. Don't forget to like and subscribe to my channel for more educational content. Thank you for watching, and I'll see you in the next video.